As the threat of COVID-19 continues, so does that of non-communicable diseases or NCDs, which are on the rise among Filipinos. What can be done to lessen heart disease, cancer, diabetes, and other illnesses in the country? We speak now with Dr. Graham Harrison of the World Health Organization, Philippines. Doctor, thank you so much for joining us on The Final Word. Let's get first to this goal of this administration to get more Filipinos boosted. In many countries in Asia and around the world, we see people already have their masks off. Many of them already have either been boosted for the first time and boosted for a second time. Why still that hesitancy here in the Philippines, Doctor?
Good evening, Rico. We've done several studies with the Department of Health to try and identify what the issues are. In the early stages, of course, it was vaccine preference for particular brands, but we have all of those available now, so that's not the issue. Potentially, several issues seem to come to light. One is about access to vaccines, very practical issues, transportation, these sorts of things, which can be quite expensive if people have to come a long distance. But I know that the Department of Health and that is trying to get out into the field, close to people, so that they can actually access the vaccines. Some people are at work, can't take the time off and that sort of thing. But we also know that some seniors are afraid of needles and syringes, and that it's just one of those things. So I think there are a number of social concerns, practical concerns, as well as concerns about side effects that have to be addressed. But it's very difficult we can't pinpoint one or two things. It's a range of things and different for each individual.
And of course, you talked about senior citizens, elderly people. Many of them, of course, Dr. Harrison, have comorbidities, non-communicable diseases. Why are they at most risk with the COVID-19 pandemic?
Right, well the NCDs, of course, they're diseases, and so they're already causing damage to people's bodies. So for smokers, for example, they may have diminished lung capacity, and for people who have cardiovascular diseases, there is damage to their small blood vessels and that. And of course COVID-19 can increase the inflammation and basically build on top of that. So people with these underlying diseases, COVID-19 seems to be very good at trying to hit people who have disease already, but we can't predict why one person with diabetes is more severe than another person with the same disease, but we just know that the risk is there. And of course for older people as well, they tend to have more of these diseases. They may not know that they've got them, but they tend to have more as well.
And also, one other reason could be, Dr. Harrison, is that also a lot of elderly people or those who have comorbidities don't also have access to meds to prevent them from, and to protect them from these non-communicable diseases.
Yes, indeed. So it's very important that people have access to services. They can get checked up. I mean, in many cases, for cardiovascular disease, one of the simplest things is checking the blood pressure and getting treatment for it. Now this we know for some people is difficult because it costs quite a bit. But through PhilHealth and other, those sort of mechanisms, in fact, there are some medicines available that are subsidised in that.
And of course, the Department of Health has also said that they also want to expand the number of generic manufacturers here in the country to make meds more affordable to our Filipino people.
Yes. Generic access is an important issue. I mean, in general, we have, I think, about 20% of total health expenditure goes on medications. And of total health expenditure as well, about 44-45% is coming from out of pocket from households. So a big chunk of that is actually going towards medications.
Could there also be hesitancy, Dr. Harrison, among those who have non-communicable diseases, cardiovascular diseases, diabetes, cancer, that by getting maybe their primary dose, their first booster and their second booster, that this could impact them rather than help them?
You mean that the vaccine could
Yes, the vaccines, yes.
Maybe there's some concern on that, but in reality they are much safer to actually get the vaccine. getting the disease, there's a much higher chance that they'll actually get severe illness or even death. Whereas we do know that the vaccines are very effective at reducing people's chances of actually getting severely ill. And so while they might get mildly so, hopefully we can keep them out of hospital and also keep them from dying.
Because they continue to have to be educated. There's still that fear and anxiety among many Filipinos regarding vaccines and boosters. But one very telling data that I saw, Dr. Harrison, is that we're seeing a rising number of NCDs among the Filipino youth. Why is this happening?
Well, I think a number of factors. I mean, we have to look at the key contributors to NCDs: physical inactivity, unhealthy diets, tobacco use, harmful use of alcohol. And of course, the earlier you're exposed to these, the bigger the impact can be as well. We've seen, like in 2019, we had the Global Youth Tobacco Survey, 13 to 15-year-olds, 6,600 across the country. 18% of boys and almost 7% of girls were at that time using tobacco products, which is quite alarming, really. And that's just the start, of course, and a number of people take it up later in life.
So how can this be remedied, Doctor? How can the government prevent and treat cardiovascular diseases and other NCDs among the youth?
Well, multiple things, because of course it's things like diet and that as well. You know, these kids are exposed to a large number of things on the social media, a lot of marketing for unhealthy foods and that. And we know that Filipino youth, in studies that have been done, have fairly regular intake of instant noodles, chips, sugary drinks, these sorts of things, which really are not good if they're taking them regularly. And we need to try and encourage them and hopefully make it easier for families to provide more nutritious meals and get people to understand that taking these high sugar, high salt, high fat, high carbohydrate things all the time is, in the end, it's going to actually be a disadvantage for them. It's going to cause problems.
Dr. Harrison, we would like to thank you for the advice and for your insights and for joining us right here on The Final Word. Dr. Graham Harrison from the World Health Organization, Philippines.